Okay, so today we're doing a thong lift or a gluteal sort of fold excision. So you see all this skin that's sort of hanging out the bottom there. She's had an upper buttock lift, but sometimes we can get the bottom to fall down. So this actually came out from Miami. It's called a thong lift. It's been around forever. Tito Mendieta, for all you kids who like history, is actually one of the docs who really made this popular. We do it very rarely because we can usually do it with liposuction Renuvion, but in this case we've just got loose hanging skin and it wouldn't do it, so we got cut out. So we're going along that fold line, and you can see I'm lifting up. Now this is super cool anatomy. So this is superficial fat and then deep fat, which is held by a layer of superficial fascia. And on the thighs, especially and around the pubis, it's a very thick fascia. You can see how that bright white layer. So I'm actually going to leave that fully intact. And the reason I'm going to leave it fully intact is we got big blood vessels and very important nerves that are below that. And I can sew into it, and we know that that's going to hold it up because it's such a good sort of layer. Now you can see I'm lifting up and I'm checking that flap and I'm readjusting it and I'm pulling it back down to make sure I can get up, because we want to take as much as we can, but we also want to make sure that we don't take too much. So how do we do that? Well, I flex the patient just slightly so that we know that when they're sitting on the bank forward that it won't tear, but it also helps get out. So you can see we're just going to go, I'm kind of just making little notches. We're just sort of going along, we're notching. And the reason that we're doing that is because different parts of this incision are actually going to remove skin differently. And that's because this is a sort of elliptical shape, and it's also got volume. So we're moving 3 dimensions. So we would expect tightness areas to be different. Now, you can see as we're moving it out there, we've done 3 layers of closures. We did that deep closure with a big old 1 PDS, and then we did 2 other layers. Look at that difference, tightened it up, amazing.